Hello everybody. I'll talk about the bones of the skeleton. Human skeleton consists of two parts, the axial part and the appendicular part. Appendicular skeleton includes the bones of your upper and lower extremities. Okay, and appendicular skeleton consists of girdles and limb bones. So you have two upper limbs and two lower limbs, and they are connected to the axial skeleton or trunk of the body by the girdles. You have two pectoral girdles and one pelvic girdle. Okay, and girdles attach the limbs to the skeleton. Okay, so there are two pectoral girdles, one in each shoulder. Okay, and they connect or attach the upper limbs to the trunk. And the pelvic girdle is only one, and it connects two lower limbs to the trunk or skeleton, axial skeleton. So we'll talk about the girdles and then upper and lower limb bones. First, we'll talk about the pectoral girdles. Each pectoral girdle is formed by two bones, clavicle anteriorly. Clavicle is also known as the collarbone, and scapula, this one, posteriorly in the back. So these two bones join together at the acromioclavicular joint and form the pectoral girdle. So you have two pectoral girdles, and the upper limb joins the pectoral girdle here at the shoulder joint. Okay, so first we'll talk about the bones of the pectoral girdle. This is a clavicle. This bone is placed horizontally in the body. Most of the long bones are placed vertically like this. However, this clavicle is placed horizontally. And the clavicle has two ends. This end, which is the medial end, gets attached to the sternum. That's why this end is called the sternal end. Makes sense? And this end is attached to the acromion. That's why this is called the acromial end. Okay, so two ends. This is the acromial end, which is the lateral end, and this is the sternal end, which is the medial end here. Now, the sternal end is round, kind of round, and acromial end is flat. Okay, and this is the body, and the fracture often occurs in the middle of the body of the clavicle, and most of the cases fracture occurs due to a direct blow. If something hits from the front, comes from the front and hits this bone, then fracture would occur here. And if someone falls on the shoulder, that would also cause the fracture of the clavicle, because clavicle is located more forward or anteriorly than the ribs. So if you fall onto the ground, the ground will first hit the clavicle here. Clavicle is also known as collarbone. In female, we also use the term beauty bone. So that is the clavicle. This is a scapula, which is also commonly known as a shoulder blade. Scapula is located posteriorly in the shoulder girdle, and it looks like a triangular shaped bone, and it has three angles. This is the superior angle, this is the inferior angle, and this angle is called the lateral angle. And in this angle you have few structures. First, if you see the front of the scapula, this part, the whole part is flat and slightly curved. So this whole area is called as the subscapular fossa. Why it is called a fossa? Because it is slightly curved and it's a kind of depression here. So that is the subscapular fossa. And subscapular muscle, and if you see the back, let's see the back. You see in the back there is a structure that sticks out from the back, and this is called the spine of the scapula. Okay, and this spine becomes this structure that is called the acromion. Okay, so spine becomes the acromion. Okay, and the spine arises or sticks out from the back of the scapula, and this area above the spine is called the supraspinous fossa. Makes sense? Supraspinous because it is above the spine, and this area below the spine is called infraspinous fossa. And in supraspinous fossa, supraspinatus muscle is attached. Supraspinatus muscle. And in infraspinous fossa, below the spine, the muscle is called infraspinatus. Okay, infraspinatus muscle. Anyway, so this is the front and this is the back. Okay, in the front you have only one large fossa that is called the subscapular fossa. In the back you have two, supraspinous and infraspinous fossa, and this structure is called a coracoid process. Okay, so coracoid process looks like a beak of a bird. The name coracoid came from the beak of a bird. It looks like a beak of a bird probably, and you have a shallow socket or cavity. It's like a shallow cup like a structure that is for the head of the humerus to form the shoulder joint. Okay, and this is called the glenoid cavity at the lateral angle. So here you see this is the glenoid cavity at the lateral angle, and acromion and coracoid process. Okay, scapula has three borders. This is the superior border, this is the medial border, and this is the lateral border. In the superior border you'll see a notch, U-shaped area, and that is called suprascapular notch. Supra means above the scapula notch. So those are the features of the scapula. Now we'll see the bones of the upper limb. In each upper limb you have total 30 bones. You have one bone in your arm, that is the humerus, you have two bones in the forearm, radius laterally and ulna medially. So lateral bone of the forearm is the radius and medial bone of the forearm is the ulna. Okay, and then in your hand you have 8 carpal bones, and these are short bones, small short bones called the carpal bones, and you have 5 metacarpals and 14 phalanges. Carpal bones are in your wrist. Okay, 5 metacarpals, those are in the palm of the hand, and phalanges are finger bones. Okay, so first we'll see the arm bone, which is the humerus. Humerus is the largest, longest bone of the upper limb, not the whole body. Femur is the largest bone of the whole body, but humerus is the largest bone and longest bone of your upper limb, and articulates superiorly with the glenoid cavity that I showed you in the scapula to form the shoulder joint. Okay, and lower end of the humerus articulates with the radius and ulna, two forearm bones to form the elbow joint. Okay, so this one is shoulder joint. So the head of the humerus articulates, or upper end of the humerus articulates with the glenoid cavity of the scapula to form the shoulder joint, and lower end of the humerus articulates with the radius to form the elbow joint. Okay, first we'll see the upper end. This is the upper end of the humerus here, and this is the lower end here, and this is the shaft. Okay, so two ends are connected by the shaft. The upper end has a nice round head that forms the shoulder joint. Then around the head, this area is called the anatomical neck. It is pretty narrow area. Okay, anatomical neck. Then you have two tubercles, elevated structures. This one is bigger, that's why this is called the greater tubercle, and this one is smaller, this is called the lesser tubercle. So two tubercles, and in between the two tubercles you have a groove, sulcus, and that is called intertubercular sulcus. Makes sense, right? Inter means in between the tubercles, in between greater and lesser tubercles you have this groove, elongated groove, and that is called the intertubercular sulcus, through which the long head of biceps muscle passes. So the long tendon of long head of biceps muscle, okay, passes through the intertubercular sulcus, and then where the upper end joins the shaft here, this is called the surgical neck. So this bone has two necks. Around the head, this is the anatomical neck here, and where the upper end joins the shaft, that is the surgical. Why it is called the surgical neck? Because most of the cases fracture of the humerus occurs here. Okay. Then let's see the lower end. The lower end of humerus articulates with the radius and ulna to form the elbow joint, and this round structure is called the capitulum. It articulates with the head of the radius And this kind of rectangular structure here, that is called the trochlea, articulates with the ulna. So trochlea articulates with the ulna and capitulum articulates with the radius. Okay, and that's how the elbow joint is formed. So those two are articular structures. In the front of the lower end, you have two fossa, depression, basin-like depression. Above the capitulum, this is called the radial fossa, and above the trochlea, this is called coronoid fossa. When you flex your forearm, the head of the radius moves from here to here. So that's why you have a fossa there, and that is called the radial fossa because the head of the radius goes into it. And this is called the coronoid fossa. When you flex your forearm, the coronoid process of ulna goes into it. Okay, that's why it is called the coronoid fossa. And in the middle of the shaft, there is a rough area that is called deltoid tuberosity for the insertion of the deltoid muscle. You know, deltoid muscle where you get the short injection in the upper part of the arm. That muscle gets inserted here. Okay, the lower end gets attached here. So that's why it is called deltoid tuberosity. The dysfunction of the muscles or joints in your shoulder can be tested in a method that is called Apple's scratch test. This is a very simple test. You can do yourself too. You have to scratch the back of your scapula of the opposite side. Okay, so if you test the left shoulder, you will try to reach the back of the right scapula through, so from below, putting the hand behind the trunk of the body and try to reach there, or from above through the back of the head, you will try to reach to the opposite side's scapula. Okay, so if you can do that without restriction or pain, joint is in good shape. Okay, a couple of clinical conditions related to the shoulder or the pectoral girdle. Shoulder dislocation, very commonly heard clinical condition. You see here, this is the glenoid cavity here, and this is the head of the humerus. And glenoid cavity, I mentioned before, is not too deep. It is a shallow socket, okay, or cavity. So what happens, the head of the humerus is not strongly held in the glenoid cavity because of its shallowness. So most part is outside of the glenoid cavity, the head, so it can easily come off from the glenoid cavity, and that is the shoulder dislocation. And it happens in sports very often, in football or soccer. Okay, uh, it is pretty commonly heard dislocation. And another dislocation that happens here, you see, this is the clavicle and this is the acromion of the scapula. So this joint is called the acromioclavicular joint or AC joint, acromioclavicular joint. I showed you this joint before. This is the joint that attaches the clavicle and scapula. If dislocation occurs here, or shoulder separation, so if the head of the humerus again comes off from the glenoid cavity, that is called the shoulder dislocation. However, if dislocation occurs here, at the acromioclavicular joint, that is called shoulder separation, and that may cause dropped shoulder. This side of your shoulder will look lower than the other side, okay, because of the dislocation here. This shoulder separation at acromioclavicular joint or AC joint can occur due to weakness or tearing of this ligament here, okay. So if the ligament that holds the clavicle and the scapula here is teared or injured, then this joint will get separated. The bones will go away from each other, okay, and that is shoulder separation. Now, dropped shoulder is a condition in which if you see the person, you will see that one side of the shoulder is lower than the other side. What can cause that? Many things can cause dropped shoulder. Usually happens in a dominant side, the side you use more. If someone lifts heavy weight every day, at his work, that may cause drop shoulder. Or if the muscles or ligaments get weak, that can also cause the dropped shoulder. Some sports like golf, the person uses one side most of the time, so that can cause dropped shoulder. So some sports that uses one side too much than the other side, that may lead to dropped shoulder. Here you see this is the shoulder joint, and this is the acromioclavicular joint here, which got separated, okay. And as I mentioned before, that surgical neck of the humerus, this is the humerus, so surgical neck is here, and fracture occurs very often here, and that is the fracture of the humerus at the surgical neck area. Now we'll talk about the bones of the forearm. Forearm has two bones. The medial bone is the ulna and lateral bone is the radius, I already mentioned. And if we see these two bones together here, the radius and ulna are attached to each other at the upper and lower ends. So this is the joint where these two bones join at the proximal end, and here these two bones are attached at the distal end. So this is called the proximal radioulnar joint, the upper joint, and lower joint is called the distal radioulnar joint, okay. Proximal means towards the body and distal is away. So those are two joints hold these two bones together. Also a strong membrane, connective tissue membrane, that connects the shafts of these two bones very strongly, and that is called interosseous membrane. Inter means in between, osseous means bone. So this is a membrane, strong membrane that also holds these two bones together. So two joints and the interosseous membrane strongly keep these bones together. Now if you see the radius, the upper end of radius has a head, and this head is not spherical, but the upper surface is flat, okay, like this. So it is a disc shape, flat upper end, okay. So this is the head of the radius, and below the head you have the neck, makes sense, and below the neck you have a raised area, slightly elevated area, that is called the radial tuberosity. Okay, so those are three structures at the upper end. At the lower end, you see a small extension further downwards from the lower end of the radius, and this extended downward part is called the styloid process of radius. Same thing you have in the ulna here. You see the tiny extended portion further downwards, that is called the styloid process of ulna. So these are styloid processes at the lower ends of radius and ulnar. So that is the radius. Now let's see the ulna. The upper end of ulna has two processes. This is called the olecranon process, the upper one, and this is the coronoid process, the lower one. So this is the coronoid process here, and this is the olecranon process here. Okay, and in between you have an U-shaped area that is called the trochlear notch. Trochlear notch. It articulates with the lower end of the radius where you have the trochlea. If you go back here, you see this is the trochlea. So that notch is for this trochlea, perfectly fits into it. So that's why it is called the trochlear notch. So those are the things at the upper end. So upper end looks like an open mouth. It has, like, the upper jaw, then U-shaped, and this is the lower jaw. Okay, like this. So this is the olecranon. Process, and lower jaw, if you just think it is an open mouth, this is called the coronoid process. So olecranon process, coronoid process, and this U-shaped area where the trochlea fits, that is called the trochlear notch. Okay, so that is the upper end of the ulna, and at the lower end, as I mentioned, there is an extended part that is called the styloid process. Okay, this is the elbow joint I mentioned already. The head of the radius articulates with the capitulum at the lower end of the humerus, and this is the trochlea, articulates with the trochlear notch of the ulna, and that is the elbow joint. Okay, bones of the hand. In your hand you have three sets of bones. Short bones are the carpals or carpal bones. How many? 8. They form 2 rows. You see here 4 and then another 4 here. Okay, so they form 2 rows in your wrist. So carpals are wrist bones, and then you have 5 metacarpals in your palm. And we start counting from the thumb side. So this is the thumb side, and the metacarpal in your thumb side is number 1, then below the index finger, and then number 3, number 4, number 5. So we start counting from the thumb side. So there are 5, and then the finger bones. You have 2 bones in your thumb, distal and proximal, and in other 4 fingers, in each you have 3 phalanges or finger bones: distal, middle, proximal, distal, middle, proximal. Okay, so in these 4 fingers you have 12, 3 in each, and this one has 2, so total 14 phalanges or finger bones. Okay, so those are the bones of your hand. Now we'll talk about the pelvic girdle. Pelvic girdle attaches the lower limbs to the axial skeleton. So lower limbs are attached to the axial skeleton by the pelvic girdle. And as I have mentioned, we have one pelvic girdle which is formed by two pelvic bones or hip bones. Two pelvic bones uh, joined together to form the pelvic girdle. Okay, and let's see the pelvic girdle. This is a pelvic girdle. This is one hip bone. This is another hip bone, and they join here by a piece of fibrocartilage. This is a fibrocartilage called the pubic symphysis. Okay, so this is the only joint that connects the two hip bones. Okay, pubic symphysis. This is a sacrum, and this is actually not a part of pelvic girdle. Okay, pelvic girdle is formed by only two hip bones or coxal bones or pelvic bones, same thing. And now if you add the sacrum, that whole thing is called the bony pelvis. So now I can say that bony pelvis is formed by pelvic girdle and the sacrum. Makes sense? So two hip bones together form the pelvic girdle, and pelvic girdle and sacrum join together to form the bony pelvis. So this whole thing is a bony pelvis, and the bony pelvis of a male and a female is quite different. There are a number of things those are different in a male and female bony pelvis. Anyway, so the hip bone or pelvic bone or coxal bone, same thing. Okay, has three parts. The whole upper part is called the ilium, and lower back part is called the ischium, and lower front part is called the pubis. So whole upper part and lower back and lower front is the pubis. So ilium, ischium, pubis. So you see those three parts are shown by three colors. So this is the whole upper part is the ilium, and this is the lower back ischium, and this is the lower front pubis. Okay, and when this bone is formed, they start to uh, originate from three separate points. So from here the ilium is formed, from here the ischium is formed, and from here the pubis is formed, from three ossification centers. And the bone gradually, three parts grow and meet finally inside the socket here, that is called the acetabulum. So you see three colors, they joined here. Okay, so three pieces grow separately and finally join inside the acetabulum. Okay, anyway, so this is the whole upper part, ilium, and the upper border of the ilium is called the iliac crest. Okay, so this is the iliac crest, the upper border. Okay, and then this is the lateral view. So in the lateral side of the ilium you have lines. These are called gluteal lines, and the gluteal muscles get attached to this side, attached to the lines. And now in the front of the ilium you have two spines. This is called anterior superior iliac spine. Makes sense? Spine in the ilium, that's why I called iliac spine. Why it is called anterior superior? Because this is the anterior, this is the posterior. So this is anterior. And why superior? Because this is the upper spine, this is the lower spine. Okay, so this is anterior superior iliac spine, and this is anterior inferior iliac spine. Okay, inferior means below. This is the upper one, this is the lower one, two spines. And in the posterior side you have posterior superior iliac spine, and this is posterior inferior iliac spine. Okay, so those are the structures in the ilium. Then if you see the ischium, the lower back part, ischium has couple of structures. This rough structure that occupies almost half of the ischium, this is called the ischial tuberosity, the rough structure here. And actually it sits on the ischial tuberosity. When you sit on the ground or on the chair, you sit on this ischial tuberosity. And this sharp structure is called the ischial spine. So ischial tuberosity is this rough structure, and this pointed structure is called the spine. And now there are two notches. One is above the spine and another is below the spine. You see this big notch here. This is called the greater sciatic notch, which is above the spine. And below the spine, this small notch, that is called lesser sciatic notch. So both are sciatic notches. The upper one is bigger, that's why I call it the greater. Lower one is smaller, that's why it is called the lesser sciatic notch. Sciatic nerve, the largest nerve of the body that passes through the sciatic notch. And then let's see the pubis. This is the pubis, lower front part. And as I mentioned before, that two hip bones join to each other by a cartilage which is attached here, and that is pubic symphysis. So pubis is the part of the hip bone that forms that joint here. See, this part is the pubis. So two pubises of two hip bones join here by this cartilage, pubic symphysis. So pubis actually is the part that forms the joint. Okay, and this is the ischium, this is the ilium. Okay, now a couple other structures are present in the hip bone. This one is a large deep socket for the head of the femur, and the head of the femur enters or fits into it very strongly. It is not like the shoulder joint. You remember in shoulder joint, the glenoid cavity of the scapula is shallow. That's why dislocation occurs very often. But this socket in the hip bone is pretty deep and can strongly hold the head of the femur. So hip joint is very strong joint. It will not, dislocated or separated easily. So that is called the acetabulum. And this oval shaped opening, large opening, is called the obturator foramen. So from your pelvic cavity, the obturator nerve and blood vessels go to the thigh or lower limb through the obturator foramen, because you know that arteries and nerves should enter into the lower limb from your body, from the pelvic cavity. So That's why you have that large foramen, obturator foramen. So those are the parts of the hip bone. Now, as I mentioned, that the bony pelvis of a male and female uh, look different. Why they look different? Because the main reason is female bears the child. So the fetus grows inside the uterus in the pelvic cavity, right? So in case of female, you need bigger space here. In male, you don't need that big space. So if you see the bony pelvis of a female, it is much wider than the male. Okay, and this opening here, the lower opening, is also wider. This opening is called the pelvic brim. So this brim is also wider. So whole bony pelvis in female is wider, as well as this pelvic brim here. Pelvic brim is wider in female than the male. Okay, it makes sense because the uterus gets bigger when the fetus inside the uterus grows. Okay, until the childbirth. And also the lower outlet, if you see the outlet here, in female the outlet is bigger because that helps the childbirth. The outlet is wider, so the child fetus can easily get out. So three things are wider in female. Whole bony pelvis is wider, the pelvic brim is wider, that is the upper opening, upper space, and the outlet is the lower opening, which is also wider in female, and that helps in childbirth. So the female bony pelvis is different than male to perform two important functions. One is childbearing, and number two for childbirth. Also, if you see the sacrum here, this is the sacrum. Okay, the sacrum is more backwards, directed more posteriorly in female. This is female, this is male. So you see, female sacrum is more outwards or backwards, and male sacrum is more inwards. So this also allows the space for childbirth wider, makes it more wider. Even after that, when childbirth occurs, the tiny tail bones sometimes get fractured because of the pressure. However, those few things help in child bearing and birth. Bones of the lower limb. In your lower limb, you have also, each lower limb has 30 bones like your upper limb. So we'll see what are those bones. In your thigh, you have the longest and largest bone of the body, that is the femur, which is also the strongest bone. And the upper end of the femur forms the hip joint. You remember the acetabulum, that deep socket in the hip bone. So the head of the femur goes into it and forms the hip joint. And the lower end of the femur articulates with the tibia, fibula, and tibia and patella to form the knee joint. So lower end of the femur forms the knee joint and upper end forms the hip joint. So this is a femur. First let's see the upper end. Upper end has a nice spherical round head, and next to the head you have a pretty long neck in the femur, and then you have two trochanters. Large irregular bony mass is a trochanter. So this is a greater trochanter, bigger one, and this is a lesser trochanter. Okay, and if you see the front of the upper end, these two trochanters are connected by a line that is called intertrochanteric line. Inter means in between the trochanters, right? Now if you see the back, the other side, this is the back. These two trochanters are connected by a crest, and that is called intertrochanteric crest. So intertrochanteric line in the front, intertrochanteric crest in the back. Okay, and now let's see the lower end. The lower end has two condyles. Condyles form the knee joint. Okay, and above the condyle you have elevated area that is called epicondyle. So let's see in this side, this looks better. So this is the condyle. So two condyles. This is the medial one, this is the lateral one, and above the condyle you have elevation, and that is the epicondyle. So two condyles form the knee joint, and two epicondyles are outside of the joint. Now let's see the front of the lower end. You see this nice articular surface. It is for the patella. The kneecap gets attached here. This is the kneecap. So kneecap is attached here, and in the back you have a fossa, basin-like depression, and that is called intercondylar fossa. Makes sense? Inter means in between the condyles. So intercondylar fossa. Okay. So this is the back, that means posterior. This is the front or anterior. Okay, and now let's see the shaft, middle portion. In the shaft you have a line. In the upper part you have a single line that is called the linea aspera, and that line divides into two in the lower part, and these are called the supracondylar lines. Makes sense? So this is condyle, so above the condyle, supracondylar lines. Okay, so linea aspera, then two supracondylar lines in the lower part. Okay, and in this bone there is a tiny foramen here for the nutrient blood vessels. This is called nutrient foramen. Okay, in the middle of the shaft. So blood vessels, nutrient blood vessels pass through it. Bones of the leg. In your leg you have two bones, tibia and fibula. Tibia is the medial bone, and fibula is the lateral bone. Tibia is bigger one and stronger one, thicker one, and fibula is smaller, that means weaker. Tibia transmits the body weight. It forms knee joint, articulates with the lower end of the femur. Okay, and transmits body weight. Okay. Fibula doesn't form the knee joint, it doesn't articulate with the femur, so it only supports the leg muscles. Okay. So here you see this is the tibia and this is the fibula and this is medial and this is lateral, and if you see the upper end of tibia you have two condyles, and you remember the lower end of the femur you have also two condyles. So two condyles of lower end of femur articulates with these two condyles of the tibia. Okay, so at the lower end of femur you have two condyles, at the upper end of tibia you also have two condyles and they join here. Okay, and in the front of the upper end of tibia you have rough elevated part that you can actually feel below your kneecap or patella. You can feel with your hand or finger. That is called the tibial tuberosity. So what happens from the patella, the patellar ligament comes down and gets attached to the tibial tuberosity. So this is for the patellar ligament, and upper end is attached to the patella. That's why it is called the patellar ligament, comes from the patella. Okay, now the lower end you see like your radius and ulnar, small extended part that goes further downwards, and this is called the malleolus. In case of your upper limb, similar structures are called styloid processes. In case of leg bones, malleolus, but structurally they are similar. And this is the fibula, and this is the upper end or head of the fibula, which articulates with the tibia from the proximal tibiofibular joint, and this is the distal tibiofibular joint. So these two bones are attached to each other in very similar ways of radius and ulnar. You remember radius and ulnar, those two bones also join to each other at their upper and lower ends and form proximal radioulnar and distal radioulnar joint. Similarly, tibia and fibula also get attached to each other at their upper and lower ends and form the proximal tibiofibular joint and distal tibiofibular joint. And also the shafts of these two bones are attached by interosseous membrane. Very similar way the radius and ulnar are held together. So that's how these two bones are strongly held together. Okay. Now the bones of your foot. In your foot you have 7 tarsals. Now you remember in case of your hand you had 8 carpals. So in your foot you have 1 less. However, you remember in your knee you have 1 bone that is called the patella, which is not present. Similar bone is not present in your upper limb. So here, although you have 1 less tarsal than carpals, you have 1 extra bone in the knee, that is the patella. So you know the number, total number is 30 in both upper and lower limbs. So here in the posterior part of your foot you have 7 tarsals. The largest tarsal is called the calcaneus, which is also known as heel bone. Okay, and in the back of the calcaneus the strongest tendon, which is called the tendo achillis or achilles tendon, also known as calcaneal tendon or tendocalcaneus, gets attached here in the back of the calcaneus. This is another bone located above the calcaneus, and this is called talus. So talus is another tarsal bone, and the upper surface of the talus you have the trochlea. This surface articulates with the lower end of tibia. So very important, this articular surface of the talus, which is the upper surface of the talus, articulates with the lower end of the tibia to form the ankle joint. Okay, ankle joint. So calcaneus, why it is important? Because it is the heel bone. So body weight is mostly transmitted to the ground through this one, heel bone. And in the back of the calcaneus, the strongest tendon, that is called the Achilles tendon or tendoachilles or tendocalcaneus, is attached. 3 cuneiform, medial cuneiform. Okay, then you have the intermediate cuneiform and lateral cuneiform. So 3 cuneiform, and then 1 navicular, 1 cuboid. So those are other 5. So total 7. 1 calcaneus, 1 talus, 3 cuneiform, and 1 navicular, 1 cuboid. And they join together to form almost the half part of your articulated foot, the posterior half. And the anterior half is formed by the metatarsals and phalanges. The number of metatarsals and phalanges are same as the number of your hand bones. So you have 5 metatarsals. In your hand you have 5 metacarpals, the name. So from the big toe side we start to count. So this is your big toe here. So this is number 1, number 2, number 3, number 4, number 5, and then in your big toe you have 2 phalanges like your thumb, and in other 4 toes you have 3 in each. So total 14 phalanges, 5 metatarsals and 7 tarsals. This one is 1 less in number than the carpals, than the hand. However, that number is replaced by the patella in your knee. So the bones of your foot, 1 less than the bones of your hand. Okay. Sometimes, particularly the girls put on high heel shoes, and this calcaneus is actually to transmit the weight. Now if you put high heel, then what happens? A lot of weight is transmitted this way instead of going downwards. Weight is also given to these bones, and these bones are not designed to carry or transmit heavy weight, and that can cause inflammation in these joints in the foot. So those are the bones of your appendicular skeleton, the bones of your upper and lower extremities. Quickly let me mention that in your upper extremities, how many pectoral girdles you have? 2. Each pectoral girdle is formed by a clavicle anteriorly and a scapula posteriorly. So you have 2 clavicles and 2 scapula. Okay, and then the bones of your upper limb. Each upper limb has 30 bones. The bone of your arm is the humerus. In your forearm you have the radius laterally, ulna medially. In your hand you have 8 carpals, 5 metacarpals and 14 phalanges. In your pelvic girdle you have only 1 pelvic girdle, which is formed by 2 hip bones. Okay, and then you have the lower limb bones. The bone of the femur, thigh is the femur, which is the longest and strongest bone of the body. And then in your leg, you have two bones. Medial bone is the bigger one, that's the tibia, and lateral bone is the thinner one, smaller, weaker one, that is the fibula. And then you have a kneecap in front of your knee, that is the patella. And in your foot, you have 7 tarsals, 5 metatarsals, 14 phalanges. Okay, so those are the bones of your appendicular skeleton.